oxygen supply. These are oxygen delivery devices. Oxygen supply is from the vacuum insulated evaporator, big gas tong yang letak dekat luar daripada hospital, 50 meter away, that is supplied to the wall and come to the cylinder manifold. That is our gas oxygen supply, or cylinder supply for your gas, or oxygen, or CO2, or nitrous oxide. But these are delivery devices from this oxygen source, how the oxygen being delivered to the patient. Okay. So it can be classified in a two-way oxygen devices as a positive ventilation or negative ventilation. Positive ventilation as in you use a ambu bag, or you use a ETT, NIV. All these are positive ventilation. So this one we will talk about another time. Now what we're going to talk about is simple oxygen devices, which is negative pressure ventilation in a patient who are breathing spontaneously. So how it can be classified further? It's classified based on the performance of a device. Fixed performance means Venturi mask. What is called fixed performance? Performance means you can actually fix like 40%, 60%, that sense, 31%, 28%. So it can be calibrated and it can be fixed. Or variable performance. Variable performance means you are giving a flow of liter, but the FiO2, the fraction of inspired oxygen that patient finally gets based on the patient's spontaneous effort and the air and treatment. How much of the air being diluting the oxygen. So like nasal prongs, face mask, and everything. Next, another way of classifying in the based on flow delivered by the device, whether they need a higher flow or low flow. So let's say you're getting Venturi mask. When you put a patient on Venturi mask, you always put the patient on like 10 liter or 8 liter or 15 liter based on the percentage of the oxygen needed, which is stated on the Venturi mask, the adapter we are using. So they are high flow. Low flow as in we are using for a nasal prong, only 3 liter, 4 liter, or face mask, or partial and non-rebreathing bag. So if you can ask me, partial and non-rebreathing mask is the high flow mask. But here also we use 15 liter. Venturi mask also we use 15 liter. We also only 10 liter. But why is high flow? If you look at it, by giving 10 liter or 15 liter in Venturi mask, we are only able to achieve maximum of 60%. For you to achieve 60% in a Venturi mask, you have to give 15 liter of oxygen. High flow, but you only reach 60%, 60. But in a high flow mask, by giving 15 liter oxygen, you can reach up to 90 to 95% oxygen. So that's why low flow, it's relatively low flow to achieve a higher percentage oxygen compared to Venturi mask, where you have to give a higher flow, but you're still reaching a lower percentage of oxygen. That is the difference here. Okay, so oxygen delivery devices. Delivery of supplementary oxygen is based on liter. So you have to know roughly 1 liter of oxygen will increase the 1 liter of oxygen flow will increase the percentage of oxygen delivered by 4%. So even though the room air is 21%, we start from 20 lah. So when you give 1 liter via nasal cannula, nasal prong, it goes 24%, and it goes in that manner, like 4%, 4%. But this is just a hypothetical arbitrary formula. But as I said, these are variable performance device. So when you give, it's always a lot of variable factors that will achieve the final delivery of percentage of oxygen, as in entrainment of the air, the patient's spontaneous effort, the leak, whether the prong is perfectly inserted inside the nose or not, the leak from outside. Let's say you use a face mask oxygen, patient putting it on a forehead, patient still not covered the nose properly and everything lah. Then the simple face mask, you can give 6 to 10 liter per minute, but the oxygen delivery is very inaccurate. That's why face mask is not actually an ideal thing in a patient who have acute respiratory distress. We usually use a face mask in a post-op patient who just need an oxygen supplementation little as a post-op recovery, not actually a patient who are actually hypoxic. In hypoxic patient, simple face mask is not a very good idea because it gives a very variable oxygen supplement percentage. We are not so sure. Venturi mask is very good because you actually can fix the amount of oxygen you want to be delivered. And it's a working principle which works by a Venturi effect or Bernoulli principle. We talk about it later. So it based from 4 to 12 liter per minute. It based on the adapter. Percentage of oxygen will be mentioned in the adapter, and accordingly you have to adjust the flow. Can give up to 24 to 60%. And next is the high flow mask with the rebreathing valve or non-rebreathing. In an eye flow mask, next time you see, there will be outside, there will be two like a valve there, which has a hole. Some has it, some does not have it. So that's a rebreathing versus non-breathing. Non-rebreathing will have a higher percentage of oxygen can be delivered. Rebreathing means patient can rebreathe the oxygen from there is no valve for exit valve, expiratory valve. So whenever patient exhale, the carbon dioxide will mix with the oxygen that they are getting. So that will reduce the oxygen percentage, the fraction of inspired oxygen. In a non-rebreathing, the valve will cause a one-way exit of an exhalation valve. Okay, so that is good because the carbon dioxide which is exhaled is gone out. So the new fresh flow of the oxygen goes in is have a higher percentage of the oxygen. This is again a simple thing. You all can look at it again lah. Okay, the flap is this is the flap. If you all can see, if you can see eye flow, there'll be a flap. Some eye flow doesn't have this flap. Some eye flow has it. This is the expiratory valve, where the expiratory flap, which causes it to be a non-rebreather mask. Then the nasal cannula, simple face mask, and Venturi mask lah. Okay, so as I mentioned, Venturi mask 15 liter gives 60% only. But in a non-rebreather mask, when you give a 15 liter, you can achieve up to 95%. Okay, so think about it. So nasal cannula consists of 2 prongs. Every 1 liter will cause 4% increase. Usually 1 to 6 liter. We don't go anything more than 5 liter usually because it's very uncomfortable. It's a direct flow of oxygen into the nasal cavity. It's dry. Even though we give water muffler which is incorporated, it's still very dry and uncomfortable for the patient. Okay, that's why eye flow nasal cannula, we usually put 60 liters, 60%. It's very uncomfortable. Sometimes you can see patient will say it's very uncomfortable because the flow is too high and your nasal cavity become dry and then causes eye flow necrosis. We call it, the skin can get necrosed. Do not use more than 6 liters. It does not increase oxygenation much, yet dries up nasal pressures, uncomfortable. Oxygen concentration depends on oxygen supply flow rate, patient ventilation, patient inspiratory flow rate. This is the variable that I said can affect the FiO2. Simple face mask, various size from pediatric to big adults, adds up under 2 kilometer. So this all you can read lah, nothing much lah. You all can read. Venturi mask, okay, this is very important. Based on Bernoulli principle or Venturi effect, oxygen is passed through a narrowed orifice and this creates a high velocity stream of gas. Whenever a high flow of gas passes through a narrow orifice, the pressure increases. So the pressure at the other end will increase tremendously. This high velocity jet stream generates a shearing force known as a viscous drag that pulls room air into the mask. So your oxygen, your air will always move from high pressure to low pressure. Okay, so when there is a narrowed orifice, there will be a pressure drop. This pressure drop will act as a vacuum and will entrain room air. So this room air that comes in will dilute the 100% oxygen. I will talk about it with picture. We'll go into it. So you see, this is what we call as a Venturi effect or Bernoulli principle. So the oxygen that comes from here, from the tubing, this is a tubing. Imagine there's a tubing that comes into here. This is 100% oxygen. It's not has been diluted yet. In the tubing, it's always 100%. Okay, this is the Venturi mask adapter. This is the oxygen that's connected. So this is the oxygen source like cylinder, oxygen coming through the tubing. In the tubing, the FiO2 is 100% because it's not diluted by the room air yet. But as it goes through here, this narrow orifice causes a pressure drop here. So when there is a pressure drop here, that acts as a vacuum. The gas always flow from high pressure to low flow. There's again causal equation, right? The flow. So when there is a pressure drop, this will act as a vacuum and entrain, suck air from the room environment, room air to goes inside here based on the size of the valve adapter. Like 40% will have a bigger valve orifice compared to a 60%. So more air, room air will entrain to dilute the oxygen that's coming from here. 100% oxygen coming from here. So 60% of air will come in to here and train, diluting the 100% oxygen to 40% here. So the finally patient only getting 40% FiO2. In terms of this valve is meant for 60% Venturi mask. Only 40% of the air will entrain, sucked in like vacuumed in. So diluting the 100% oxygen from the tubing to 40% here. That's how it works. Okay. So operate on Bernoulli principle as gas flow under pressure at rapid flow rate. So this one. So flow in. At flow in is 100% oxygen. It goes in the narrow orifice here. When there is a narrow orifice, the pressure drops. So velocity increases, pressure drop. Atmospheric pressure is higher than compared to here. So atmospheric air will suck in from the hole at the Venturi mask adapter, causing the dilution of the air, oxygen, leading to the stated in the adapter like 40%, 40%, and that goes to the patient. Okay, that's the idea of Bernoulli principle. So 2 liter per minute for 24% will have a higher hole. You see at 15 liter adapter, there is no hole. Because when you have 15 liter, the oxygen comes at 60%, right? So only a smaller hole compared to the adapter. The hole will become smaller and smaller and smaller. Okay, and this color can change from company to company lah. But I think the one we have, 60% is red color, 40% is pink color. In our hospital HSA lah. This can change from company to company lah. This is not universal. Okay, so that's why you always have to check in the adapter. So the size of the inlets for air changes the difference percentage of Venturi. The flow of oxygen liter required to produce specific oxygen. So when the oxygen comes in here, let's say you put 8 liter, which is 100%, air will entrain, will diluting into 35%. Finally, we'll get 35%. A set of oxygen flow liter mixes with set amount of air defined by the size of the inlet to produce a fixed percentage of oxygen. Oxygen goes from here, room air entrain because of the pressure drop secondary to Bernoulli principle. Air with high velocity going through a constricted orifice will cause a pressure drop, causing a vacuum effect, entraining the air from the oxygen environment. That's just a repetition of everything. Okay. So based on that, you can get your percentage of oxygen, FiO2. Okay, that's about the Bernoulli principle. Venturi mask gives desired concentration of oxygen to patient. This is accurate. That's why better Venturi mask, the advantage of Venturi, good for patient with chronic obstructive airway diseases like COPD and everything. You don't want to give them 100% oxygen in a COPD, right? So you can control it. Mask with oxygen reservoir here. This is high flow mask. The addition of a reservoir back to the standard face mask increases the capacity of oxygen reservoir by 600 to 1000 ml. If reservoir bag is kept inflated, the patient will inhale only the gas contained in the bag. So the oxygen is always there. So patient breathe in, breathe out. When there is a non-rebreather, the exhale valve when the patient exhale via the mouth or the nose, that will go to the mask, the face mask, and it will go out. And the fresh oxygen from the reservoir bag will go to the patient. Okay, but when it is a rebreathing mask, there is no expiratory valve. The fresh oxygen from the reservoir will mix with the patient exhaled the carbon dioxide, and that will reduces the FiO2 of the oxygen. Rebreathed system, non-rebreathing. Rebreathing system, there is no valve. So gas exhale in the initial phase of expiration returns to the reservoir back. Provide 70 to 80% oxygen with flow rates of 10 to 15 liter. In a non-rebreathing system, there is a one-way valve that prevents any exhaled gas from returning to the reservoir back. There is no mixture. There is no mixing of the exhaled gas with the fresh gas flow from the reservoir. Can provide almost 95 to 100%. Cannot get 100% lah, because there will always a leak. So it's maximum is only 95% lah. Okay. So that's all about oxygen.